Hi everyone, this is Dr. Mina coming from the www.club17africa.org on our series SDG Targets, hashtag SDG Targets. Today we're looking at Goal 3. Goal 3 is good health, to ensure good health and well-being. Goal 3's objective is basically to ensure healthy lives and promote well-being of all at all ages. Now, Goal 3 has 13 targets, and we're going to look at those 13 targets right away. Good health and well-being cuts across every age and is the desire of everyone to remain healthy and strong even at old age. Now, the first target is by 2030 reduce the global maternal mortality ratio to less than 70% per 100,000 lives birth. Second target is by 2030 and end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births, and under 5 mortality to at least as low as 20 per 1,000 live births. Target number 3. By 2030, end the epidemic of AIDS, tuberculosis, malaria and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. Target number 4. By 2030, reduce by 1/3 premature mortality from non-communicable diseases, NCDs, through prevention and treatment, and promote mental well-being and well-being, especially mental health and well-being. And then we have the target number 5. Strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. Target number 6. By 2030, half the number of global deaths and injuries from road traffic accidents. Again, target number 6 is by 2020, half the number of global deaths and injuries from road traffic accidents. Target number 7. By 2030, ensure universal access to sexual and reproductive health care services, including for family planning, information and education, and the integration of reproductive health into national strategies and programs. Target number 8. Achieve universal health coverage, including financial risk protection, access to quality essential health care services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. Target number 9. By 2030, substantially reduce the number of deaths and illnesses from hazardous chemicals and air, water, and soil pollution and contamination. Target number 10, which is also called 3A. Strengthen properly the implementation of World Health Organization Framework Convention on Tobacco Control in all countries as appropriate. Target number 11. Support the research and development of vaccines and medicines from the communicable and non-communicable diseases that primarily affect developing countries. Provide access to affordable essential medicines and vaccinations in accordance with the Doha Declaration on the TRIPS Agreement and public health, which affects the right of developing countries to use to the full the provisions in the agreement on trade-related aspects of intellectual property rights regarding flexibilities to protect public health and in particular provide access to medicines for all. Now we have target number 12. Increase substantially health financing and the recruitment, development, and training and retention of the health workforce in developing countries, especially in LEADs, that is the LDCs and the SIDS. Now we also have the next target, which is strengthen the capacity of all countries, particularly developing countries for early warning, risk reduction, and management of national and global health risk. These are the targets for Goal 3. My name is Dr. Mina. Until I come your way in the next session, please visit www.club17africa.org. This is our information, education, and communication resource park, talking about the hashtag SDGs Targets. Bye.